millions of Americans suffer from varicose veins, which can cause some pretty severe symptoms, including swelling and tiredness. Our next guest says there are effective treatments to help relieve the pain and discomfort. This is Dr. Klubshushan Sharma. He's the founder and medical director at Arizona Vein and Laser, and he's here to answer some common questions about veins. Welcome. I want to start, though, as a vascular surgeon.
Yes.
You have seen a number of patients and have been treating patients for more than 20 years now.
That's
How
true.
common are varicose veins?
It's very common. I see about 50 patients a week with the symptoms of varicose veins.
Okay, so we want to get right to some questions, and I'll read those questions if you can respond. And these are questions from patients. What is the best procedure to deal with a small area of spider veins in the leg?
There are some options with the laser versus the sclerotherapy, where we inject some chemical into these veins, and that's the best option, the sclerotherapy.
Okay, and that's fairly new? Is that a fairly
No,
new?
it has been in practice for many years, but we have been using some much better chemical agents these days.
And that's an in-clinic treatment?
In clinic. It takes about 5 minutes to do the treatment.
And then you can go? No
That's
pain, no
right.
discomfort?
No.
Okay, let's get to question number 2. It says, how can a person tell if they have deep vein thrombosis? What are the signs?
First, the person will feel that they have some swelling in the leg. The calves, especially the calves, become sore. And if they feel very heaviness and it has come all of a sudden, or after they had some procedure done and the leg swells up, they should be concerned about deep vein thrombosis.
Okay, and this next question came from someone who had just had a treatment. It said, I had venous closure 8 weeks ago, but I am still experiencing a lot of soreness in my calf. Is my doctor giving me the right aftercare?
I would say that my recommendation is to have a venous Doppler study done as soon as possible. That deep vein thrombosis can have one of the symptoms as calf soreness or pain.
Okay, and then our final question, it says, I had intravenous laser treatment on my saphenous vein. The doctor said he only treated it from the groin to the knee, not to ankle. He said that should be enough to stop the blood flow. Is this okay, or should he have treated the entire vein?
That's not true, that treating from knee to the groin is going to do the work. Because there are many reasons the rest of the vein will stay open for a long time, and then it can become symptomatic. It will need treatment. So my recommendation is, and what I do in my practice, to treat most of the length of the greater saphenous vein, whether it's ankle or calf, but I treat most of it.
And a lot of folks who you just heard from, those questions, they had gone to see other people,
Yes.
gone to see other doctors. What makes you different? Why do you specialize in this, and why are your treatments seemingly different than those that are out there?
Because many patients I see as second opinion, and they have had the treatment done, but their symptoms are not gone yet. When I examine my patients for possible treatment, I see if there is any other reason for their symptoms. And if they have any other reason, that should be treated first, and then the varicose veins.
Okay, well, if you have a question for Dr. Sharma, Arizona Vein and Laser is offering the first 20 callers a free vein screening. If you think you are experiencing symptoms of varicose veins, Dr. Sharma will answer your questions directly by email. Send your inquiries to info@ArizonaVeinandLaser.com. Arizona Vein and Laser has 2 Valley locations, one in Glendale and their new office in Avondale. To book an appointment, call 602-298-5476 or visit them online, ArizonaVeinandLaser.com.